Hello, and welcome to Rutgers University. Rutgers Student Health appreciates the opportunity to tell you and your family more about the services and supports we offer to Rutgers students. During this brief presentation, you will be learning more about our services. What will be covered are medical, counseling and mental health services, insurance and student health fees, immunizations, student health fees, and health promotions. Please note that everything in this presentation is how we function under normal circumstances. During the current isolation period, one of our health centers remains open with limited staff and hours. All other services are being provided remotely. Let's start with medical services. Rutgers Student Health is a fully accredited primary healthcare facility. Our experienced healthcare team is comprised of physicians, nurse practitioners, physician assistants, registered nurses, and health technicians. They are experts in the care of the young adult population, particularly regarding college health issues. There are 3 health centers on the New Brunswick campus: the Hurtado Health Center on the College Avenue campus, the Bush Livingston Health Center on the Livingston campus, and the Cook Douglas Health Center on the Cook Douglas campus. Though we do our best to accommodate same-day needs, all services are by appointment only. Students can make appointments through an online patient portal or by calling 848-732-7402. Our health centers are for more than when students feel sick. For many students, college is the first time they are taking responsibility for their own health care. In addition to providing services, we help young adults make that transition. Services include physicals and wellness visits, management of acute problems such as fevers, respiratory illnesses, stomach pains, sprains and strains, and skin rashes, management of chronic illnesses and concerns such as asthma, diabetes, or high blood pressure, travel medicine, gender-specific care, sexual and reproductive health, including contraceptive management and the testing and treatment of sexually transmitted infections and HIV, and finally, immunizations and administration of allergy shots. One-day medical clinics are also regularly offered for annual flu vaccinations and HIV STI testing throughout the year at a variety of campus locations. Students should bring their insurance card with them to each visit. A hard copy, photocopy of front and back, or a digital image, again, front and back. If a specialist is required, students will be referred to one that accepts their insurance. We don't want anybody to have a surprise bill. Counseling, alcohol and other drug assistance program, and psychiatric services. College can be a stressful time for any student. Many may struggle with their emotional wellness and mental health. CAPS is the mental health support service for Rutgers, New Brunswick students. Regardless of whether you arrive on campus with a pre-existing mental health issue, develop a need for services during your time here, or just want someone to talk to, CAPS works with students to develop an individualized action plan based on each student's unique needs and the range of resources available at CAPS, within the university, and in the surrounding community. CAPS staff includes psychiatrists, psychologists, clinical social workers, and substance abuse counselors. Services include individual therapy, group therapy, crisis intervention, workshops and educational programs, referral to specialists in the community, and consultation and collaboration with campus partners. The Alcohol and Other Drug Assistance Program, or ADAP, offers counseling and support to students with concerns about alcohol or drug use, either their own or that of someone they are close to. ADAP offers individual and group services, as well as a housing option for students in recovery who would like to have the traditional on-campus residential experience, but would like to live in an environment that supports their recovery and sobriety. Psychiatric services are staffed by psychiatrists, who are physicians specializing in the diagnosis and treatment of mental health issues. Psychiatrists assist students who are using medication to help manage a mental health condition, allowing students to access psychiatric care on campus and make sure their medication is working appropriately. Community-based counselors are social workers embedded within several communities throughout the campus. One of the most popular aspects of community-based counseling is Let's Talk, which offers informal drop-in hours. Community-based counselors also work with faculty staff in these communities to build awareness of mental health issues and provide support and resources specific to that particular community. Next step is a campus-based treatment program tailored to students who need enhanced care. Students attend a combination of 4 psychoeducational groups and psychotherapy groups, 1 case management session, and 1 individual therapy session per week. There are 3 counseling center locations. The primary location is on the College Avenue campus, and a satellite location is on the Cook Douglas campus. Next step is located on the Bush campus. All visits are by appointment. Students can make an appointment through the student patient portal, by phone, or by stopping by the College Avenue location and speaking with the front desk. Students in crisis will be seen same day by the on-call clinician. CAPS also provides after-hours support through Protocol, a phone-based service when CAPS is closed. It is staffed by external master's level clinicians who are trained to provide support to college students in crisis. Insurance and student health fees. All students are required to have insurance, whether their own or through a parent or spouse. All students can utilize Rutgers Student Health Services, regardless of the type of insurance they have. All students should have their health insurance card. Again, either a hard card, photocopy front and back, or a digital image, front and back. Rutgers has a hard waiver system, which means students are automatically enrolled in the university-sponsored plan each semester. In order to waive this coverage, students are required to show proof of insurance. The university-sponsored plan covers students both on and off campus, and this year provides coverage from August 15, 2020 through August 14, 2021. Rutgers Student Health third-party bills your insurance for our services rendered. Balances are billed through student accounting and billing. A point of frequent confusion is the difference between insurance coverage and the student health fee. Insurance is for any time you utilize services. The type of plan you have determines how much of the cost of that service is covered by the insurance and how much you pay. All full-time students pay a health fee as part of their standard tuition and fees. This fee supports all student health and wellness services and initiatives. Insurance co-payments are prepaid as part of this health fee and are not required at the time of the student's visit to student health. For full-time students, co-insurance and deductibles are also prepaid as part of this health fee, up to $75 per semester. Your student fees cover all student health and wellness initiatives on campus, including medical services, CAPS, health outreach promotion and education, and public health initiatives such as vaccine clinics, dissemination of health and wellness information, and all educational outreach. Immunizations. We follow the state's requirements for all immunizations, and they include measles, mumps, rubella, tuberculosis testing for students participating in clinical activities and or at risk for exposure to blood or potentially infectious body fluids and students considered to be at risk, hepatitis B, meningitis ACYW. This vaccine is required for everyone less than 19 years of age, regardless of whether they live on or off campus, any first-year college students living on campus, and individuals with high-risk conditions. Meningitis B. This vaccine is only required for those with high-risk conditions. All immunization records must be submitted through the Rutgers Immunization Portal. The deadline for submitting immunizations is usually mid-June, but this year, due to extenuating circumstances, the deadline will be extended. Please note that only digital submissions are accepted. Hard copy, faxes, or emailed immunization records will not be accepted. If you have any questions about immunizations, please send an email to vaccine@echo.rutgers.edu. Health promotion on campus. This is provided by HOPE Health Outreach, Promotion, and Education, and we provide this in the key areas that impact college students, and that includes mental health and suicide prevention, alcohol and other drug education, sexual and reproductive health, nutrition, and general health and well-being. HOPE offers peer education in all of the above areas and collaborates closely with partners across the university to support student health and wellness. In addition, HOPE offers opportunities to students through internships and academic courses through the undergraduate public health program. Everything mentioned today can be found on the student health website, health.rutgers.edu. And please follow Rutgers Student Health at RU Student Health on Instagram, Facebook, and Twitter for up-to-date information about health and wellness and health-related events on campus. But most importantly, welcome to Rutgers.